Imagine your brain suddenly turning against you. A headache so intense even the softest sounds become unbearable, and any tiny ray of light feels like torture. Moving is painful and even thinking clearly feels impossible. If you've experienced migraines, you're not alone. Over 1 billion people worldwide suffer too. Stay till the end of this video, because I'll clearly explain what's happening in your brain during a migraine, how to stop it quickly, and reveal some bizarre historical migraine cures. If you ever had migraines, hit the like button so others can find help too. Did you know migraines affect about 1 billion people worldwide? That's 1 in every 7 people. Migraines usually start between ages 10 and 40. Women are 3 times more likely to get migraines compared to men, often due to hormonal changes. If you're one of them, remember, you're definitely not alone. Migraines often happens in stages. Prodrome. This stage happens hours or even days before the actual migraine pain starts. You might feel moody, tired, or notice cravings and neck stiffness. Aura. Not everyone experiences this, but if you do, you may see flashing lights, blind spots, or feel tingling sensation just before the headaches kick in. Attack. This is the painful part. The intense headache stage that can last from a few hours to a few days. Prodrome. After the headache, you might feel tired, foggy, or even mildly confused for a day or two, like a migraine hangover. Migraines start when your brain becomes overly sensitive due to a trigger. Common triggers include stress, certain foods, weather changes, or hormonal shifts. Imagine your brain as a sensitive alarm. Once it's triggered, it can set off a neurological storm. This reaction activates nerves, especially the trigeminal nerve, releasing CGRP, causing inflammation and swollen blood vessels around your brain, which leads to intense throbbing pain. There is also an event called cortical spreading depression, a wave of disrupted brain activity causing aura symptoms like visual flashes, numbness, or tingling. Does it sound familiar? Share your migraine experience in the comments. You're definitely not alone. Migraines affected famous people like Julius Caesar, Thomas Jefferson, Elvis Presley, and Sigmund Freud. Historically, migraine treatments were bizarre. Ancient Egyptians tied clay crocodiles to their heads. Medieval Europeans tried raw meat compresses, and some cultures drilled holes in skulls to release evil spirits. Luckily, today we have safer treatments. If a migraine strikes, try these methods. Find a quiet, dark room to rest. Back when I worked in the emergency department, I noticed something interesting. Patients suffering severe migraines often arrived by ambulance, surrounded by flashing lights and loud sirens. They entered brightly lit, noisy emergency rooms filled with people talking, shouting, and bustling around. Ironically, these bright lights and loud noises make their pain even worse. The best place for someone with the migraine isn't the bustling ER, it's quiet darkness. Remember, calmness is your best friend during migraine. Stay hydrated by drinking water. Apply a cold compress or ice to your head or neck. Over-the-counter medications like ibuprofen, taken early, often help. Moderate caffeine might ease the pain. Prescription medications called triptans can stop migraines quickly, but always consult your doctor before use. If migraines disrupt your life frequently, preventive treatment exists, including Botox injections, surprisingly effective at reducing migraine frequency. RTMS, or transcranial magnetic stimulation, uses magnetic pulses to calm overactive brain areas. CGRP inhibitors specifically block chemicals that trigger migraines. Lifestyle changes, consistent sleep schedules, regular exercise, stress management, and avoiding known triggers. Prophylactic medication. Certain medications like beta blockers, antidepressants, or anti-seizure drugs. Discuss this with your doctor. By the way, I regularly share quick practical tips on managing migraines and other conditions on my Instagram page. Check it out if you find this helpful. Migraines usually aren't dangerous, but see a doctor immediately if your headache lasts over 72 hours, you experience sudden loss of vision, speech problems, or confusion, you feel weakness or numbness on one side of your body, your migraines increase in frequency or severity. Migraines can be tough, but knowing what's happening, identifying your triggers, and knowing your treatment options can greatly improve your quality of life.
Thank you, God. Victory!
If this video helped you, hit like, subscribe for more brain health tips, and share this video with someone who needs it. Thanks for watching, and see you next time.